Hello, my name is Dr. Ghaly. I'm the principal dentist and owner at Dentistry in Canterbury and Toorak Dental Studio. My passion is to be able to provide patients with a confident cosmetic smile or an improvement in their smile. I'm really passionate about TMJ therapy as well, but my real focus is alignment and veneers.
Dr. Julie, could you tell us about dental veneers and what they involve?
Yeah, absolutely. So dental veneers are a very thin porcelain facing that gets placed onto the teeth to help improve color, shape, tooth proportions, and sometimes misalignment. So it's not too dissimilar to having a false nail that's placed onto the nail bed. Veneers are also permanently glued onto the teeth.
What is the difference between resin veneers and porcelain veneers?
Porcelain veneers are stronger. They do tend to last a little bit longer, so we expect about 10 to 15 years out of porcelain veneers, but as a result they tend to be a little bit more expensive. Resin veneers are still also a great cosmetic option. They also don't involve any removal of enamel to be placed onto the teeth, but they last about 3 to 5 years and tend to be a little bit cheaper as a result.
How do I know if veneers are suitable for me?
So the best way to find out if veneers are a good option for yourself is to come in for a consultation. What we do in our cosmetic consultations is sit down with you, find out your expectations, what your requirements are, and then take some digital scans of your teeth alongside with some photos of you smiling, lips at rest. We take a video to assess how your lip moves and what tooth display is showing. And we combine both of those to be able to show you in real life what your smile could look like with some cosmetic options.
How long do veneers last?
Veneers last as well as you can look after them. So porcelain veneers tend to last 10 to 15 years, providing that you're looking after them well by making sure you're getting your regular hygiene, your flossing, and that you are wearing your aftercare guard at night. Resin veneers do tend to last a little bit less, about 3 to 5 years is what we would normally expect, but again with the same care that's required. So again, cleaning, flossing, and wearing a protective guard at night.
How do veneers feel?
Well, most of our patients tell us that their veneers feel really natural and they fit in quite naturally into their smile, and in terms of function and chewing, they feel no different to their natural teeth. In terms of care, they still need to be cared for the same way that you would for your natural teeth. So getting your regular hygiene, brushing as per normal, flossing regularly will still help them feel a lot more natural as well.
Do I need to come in more regularly after getting veneers?
I would be suggesting that when we complete any veneer cases, we get the patient back in for a review, see if there's any bite adjustments required, if there's any changes that we need to implement. But following that, a 6-monthly regular hygiene appointment is what's required. So the same way that you would look after your natural teeth, you need to be looking after your veneers as well. So coming in to see the hygienist, making sure that the gums and the foundation that's holding the teeth and the veneers in place is still healthy is an absolute requirement. We've got a case here, and the patient has consented to share his results because he was very pleased with his journey. He presented to us with significant crowding and some cosmetic concerns, wasn't happy with his smile and wanted to look for an improvement. At this stage, it was the wrong treatment to just go ahead and do some veneers for him. The teeth were actually not in the right position. So either we needed to destroy a lot of enamel, or he was going to end up with quite thick veneers and an unnatural result at the end. So we used Invisalign technology to help align and place the teeth in the correct positions, and that's the result that we received with the Invisalign. And then following that, we placed 4 veneers on his front teeth to help improve the proportions of the smile. So now all of his teeth feel like they fit in a lot better in his smile frame. We ended up with a really nice natural result without us damaging any of his enamel. So between here to here, we just simply placed some porcelain veneers over the top with very minimal removal of any enamel. He ends up with a nice, healthy, and much improved smile.